Hello, my name is Sean Kaufman, and I'm CEO and founding partner of Safer Behaviors, and I want to welcome you to Strategic Safety, COVID-19, and Getting Back to Business. We are doing this in collaboration with corporate health partners who are cultivating a healthier workforce, and with Safer Behaviors, doing safety together following this COVID-19 pandemic. Now, over the next 20 minutes, I'm going to be providing you some facts and fears specific to COVID-19. I'll also be giving you some science that you can actually use to protect your organization, your workforce, and your clients. I will also be talking about future projections, what could happen in the future specific to COVID-19, and what you should be doing now to prepare and protect your workforce. And finally, I will be giving you some easy-to-use strategies that you can implement, which will really require not much to again focus on protecting your organization, your workforce, and your clients. So let's start first with what is Safer Behaviors? Safer Behaviors is an organization which blends behavioral science and infectious disease. How do humans behave around infectious disease threats? Now, one of the neat parts with our collaboration with corporate health partners is that we know that even though human behavior must be looked at right now during this pandemic event and in the future for all infectious disease threats that may come, we know that even though pandemics occur, chronic conditions and life doesn't stop. Meaning if you have diabetes or you have other issues in your life right now, just because a pandemic occurs doesn't mean that those threats go away. Corporate health partners not only allows for wellness coaching specific to these chronic threats, but in addition to what Safer Behaviors can offer, corporate health partners provide the psychosocial and wellness support to your employees and to your workforce that will allow them to better serve your clients. It's a beautiful synergy and a great partnership between us. But the reality is that Safer Behaviors is an organization that believes that you could have the best plans and desired outcomes. But if you do not have Safer Behaviors, you will not achieve what it is you're looking for. So what is it specific to fear that we have to really consider when we talk about COVID-19? We have to start by separating facts and fears, or what I like to say, science and science fiction. Infectious diseases have been, are today, and will always be a challenge to human, plant, and animal health. And when we get challenged, our basic needs, we start having this desire to behave. Now, I put Maslow's hierarchy of needs up because I want you to understand that infectious diseases will always remain a ticking time bomb. Why? Well, because infectious diseases challenge every single human basic need out there. It contaminates air, food, water, and shelter, which are our physiological needs. It contaminates or it makes us feel scared, both in body and mind, which we have a desire to be security. That's a human basic need. Another human basic need is our belongingness, and we know that infectious diseases challenges that because it takes loved ones away. We have another basic need called self-esteem and self-value, and when an infectious disease comes into our environment, we feel out of control. There's not much that we can do. In fact, we may even be encouraged to shelter, and that sense of self-value and self-esteem is challenged. And whenever we are challenged in life, whenever a basic need is challenged, it produces this desire to behave and to respond. And so infectious diseases will always be a ticking time bomb, just waiting until the next pandemic or infectious disease threat where it's going to produce a certain amount of behavior among individuals because their needs have been challenged. The reality is that, again, every single year we're going to face a seasonal influenza strain or some other type of infectious disease threat that we're going to have to address. And in order for us to address it, we must separate facts from fears. We have to be objective. We have to take our feelings and our opinions out and let science guide the way. Now, that may be tough because we have to trust science, and sometimes science changes. But the reality is that using science fiction to guide our decision-making processes can hurt us so much more than the actual threat itself. COVID-19 is a threat, and it's a real threat. But is it as severe as we thought it was going to be? Is it as severe as science said it was to be? And the answer at this point is no. Does it remain a threat? It does. And I'm not downplaying a threat in any way, but I am simply saying that we have vulnerable populations that we can protect, and that using science rather than science fiction, we can actually return back to work, return back to the places that we serve our clients in, and still remain very safe with good planning and implementation of good strategies, and again, with knowing the truth about the actual risk that we're facing. So we talked about the importance of separating the fears and the facts. Let's talk a little bit about what the threat is. Now, first and foremost, before I continue, I have to tell you that yes, this threat is real. Anything I'm about ready to say is not downplaying this threat. All infectious diseases are threats, including seasonal influenza. The question is how much of a threat is it as compared to other threats we encounter on a daily basis? Before I get started, I have to talk to you a little bit about the virus. SARS coronavirus 2 is what causes COVID-19, which is the disease. Now, SARS coronavirus 2, as pictured here with this image, have what we call these protein spikes. That's what you see that are red. And these protein spikes like to connect themselves to ACE2 receptors. Now, those ACE2 receptors are found in your eyes, nose, and your mouth, or any other mucous membrane. That's why it's absolutely critical for you to protect your eyes, nose, and mouth at all times. Now, SARS coronavirus 2, or COVID-19, is a lipid envelope virus, which means that outside of the human body, the fact that it's a virus means it's not living, it's actually looking to connect with a human cell. Now, this is a lipid envelope virus, and what that means is that the virus is encapsulated by an envelope, kind of protected by an envelope. And any time that envelope is interrupted or damaged in any way, it cannot connect to a live human cell and exchange information, which means then it can't replicate and cause disease. So our goal is to damage that lipid envelope virus, or that lipid envelope that surrounds that virus. And guess what? It is extremely easy for you to do. It does not take a lot of chemical agent to do this. It doesn't take hard chemicals like bleach and some of the acidic chemicals. It doesn't do that. Basic detergents, even as soft as soap is at times, will be able to interrupt that protein envelope and will be able to stop the transmission, or what we call the attachment of this virus onto ACE2 receptors. So again, being that it's a lipid envelope virus, it is the easiest to inactivate. So when it's outside of the human body, if we want to wipe surfaces down, we don't require a lot of nasty chemicals. Basic household detergents will work and be just fine in decontaminating surfaces. It's also critical that we understand how this is transmitted. This virus is transmitted through what we call micro and macro droplets. Micro droplets are these little droplets that may linger and float around. There's still so much science that needs to be done to understand exactly how those micro droplets transmit the virus. But the reality is that we know that when people talk or they're just breathing, that sometimes they'll release little droplets, and these droplets will, in a very stagnant or still room, kind of float in the air and stay in the air. Now, I believe that most of this virus is spread through what we call macro droplets. These are the big droplets that come out when we're talking, when we're coughing, when we're sneezing, when we're singing. And these big droplets that come out, they shoot out, and they can do one of two things. The first thing they can do is they can hit you. And if they hit you in your eyes, nose, or your mouth, some way, somehow, or anything that you're drinking, sometimes people will have a drink and things will fall on the drink, and you actually bring it up and it enters your body through your portals of entry, it can actually make you sick. The other way that it can make you sick is if you're coughing, sneezing, singing, and it falls onto a surface and somebody comes and wipes that surface with their hand and then touches a portal of entry, be it their eyes, nose, or mouth. These are the two ways that this virus is spread. Now, a lot of people say it's airborne, it can float. I've seen people even walking on the road and they see someone coming and they'll walk 6 feet away. Listen, 6 feet is not scientifically proven for anything. And when you're outdoors, the dilution is going to be enormous. So be careful. Be careful with the behaviors that you practice. It's absolutely critical that you know the threat. And this threat, again, is spread through either micro and macro droplet transmission in the two ways that I've been talking about. This is why it's critical to put a barrier in the environment where you suspect somebody may be sick, okay, by protecting your eyes, nose, and mouth. Now, I said suspect when someone's sick. There's been a lot of science fiction about asymptomatic carriers spreading this virus worldwide. That's not the case, ladies and gentlemen. We know using science that the most contagious people out there, the ones that spread the virus the most, are the ones that are the most symptomatic. Because when you're the most symptomatic, you're at your highest levels of shedding the virus. So, the whole theory of people walking around feeling healthy, feeling good, spreading this virus to multiple people, that just is not true science. The sickest people are the ones that give it to the most people. And so that even though there's still so much that we have to learn, the reality is that if we have good sound programs that ensure we're providing fever screening and keeping people who are potentially sick out of the building and not allowing them to interact with other people, it's absolutely critical that you understand that's the first step. That wearing a mask and gloves won't much matter if you're around sick people, because even those people who are protected will get sick. The reality is this: do your best to identify those that are potentially sick and keep them away from the healthy population. That's absolutely critical. Know the facts on this threat. Again, use the science to understand it. It is very, very easy to inactivate. It is again, very hard to get sick from somebody that's asymptomatic. And last but not least, protect your eyes, nose, and mouth, especially if you're in an environment where you think you could be working with or around people that are sick. That's absolutely critical, okay? So again, get to know this threat. It's very important, because if you know this threat from a scientific standpoint, then what you choose to do about it is going to keep you, your business, your clients, and your workforce safer. So we've talked about the threat. Now let's talk about the future. What does COVID-19 look like in the future? Well, the reality is we don't know. Now, an organization called CIDREP presented 3 potential ideas. First is what we call the fall peak. The fall peak is most likely what's going to occur because following the 1918-1919 Spanish flu pandemic and the 50s pandemic, followed by the H1N1 pandemic, or what we call the swine flu in the 2010-2011 series, what we saw was a spike initially in the fall, and then following the next fall, we saw even a worse spike. So based on projections and using a little bit of history, we believe the most common thing that's going to occur is as we approach fall again in the Northern Hemisphere, we're going to see a potential spike in COVID-19 cases. It could potentially be worse than what we've already seen. The second model is the peaks and valleys, where we recognize that COVID-19 is going to be around and will be around for the months and years to come, and we're going to continuously see spikes within a community. It'll go up and down, up and down, based on a wide variety of factors and variables, how people are behaving and what's going on. The last model is what we call the slow burn, which means that we'll have an initial spike, which we've already had, and then it'll slowly and gradually burn out, never to be seen again. Now again, the most common model, the model that many experts are believing, is going to be the fall peak. Now, it's not inevitable that it's going to happen, but I believe as a business, you should actually pay attention to this and be very proactive in how you're going to prepare and respond for the fall months. Because come October, November, and December, we could be potentially in the middle of COVID-19 again. Okay? So let's again make sure that we use this information to prepare ourselves. Because on the next slide, I'm going to give you the strategies that you need to protect you, to protect your workforce, your clients, and your business for what's to come with COVID-19. So we've talked about the future projections, and now what we're going to do is talk about the strategies that you can implement right now to protect the workforce, your clients, and your business. The 7 strategies that you can implement are spelled out in Protect. We need to first make sure that we have strategic plans in place and enough resources to make sure we carry those plans out. We also have to make sure that we are objective. What do I mean by that? That we're not using opinions and we're not using our feelings to drive our plans and the usage of our resources. We actually are using facts, scientific fact. We're being objective in how we're implementing our plans and resources. We want to make sure that we train our workforce, give them the skills that they need to feel safe, and even our clients to make sure that our business continues to run. We also want to demonstrate empathy. We want to put ourselves in position of the workforce and the clients, and we want to offer as much flexibility during these times as we possibly can. It's very critical for us to communicate quickly, frequently, and with empathy when something does go on in the organization that may be unexpected or related to COVID-19. And then last but not least, we want to demonstrate a sense of thanksgiving for the opportunity to continue to serve. We want to also offer thanksgiving to the employees that are coming in during very stressful times and to the clients that are choosing our services during these times as well. Again, we're going to start with plans and resources, but you can implement these 7 strategies right now to protect your workforce, your clients, and your business. The first 2 letters in protect are plans and resources. And again, as a leader, I think it's important that we are proactive rather than reactive. We know what the projections are. We know that infectious diseases are here to stay, and that every year we're going to run into a seasonal influenza or some type of pandemic or epidemic situation. So it's best to be prepared. Good plans and good resources are needed to protect our workforce, our clients, and our business. Now, plans don't have to be complicated. In fact, the best plans are the ones that are the simple plans. And so when we take a look at plans, you don't even need a lot of them. What you need is good strategic plans that are going to take place or take care of how people enter a building, what they do while they're in the building, and then what they're going to do when they exit the building. Now remember, you have 3 audiences that you're serving. You have to serve your clients, you have to serve the workforce, and you're going to have to serve your business. What are your business continuity and sustainability aspects? How are we going to protect the workforce and make them feel safer? And last but not least, what are we going to do with the clients to make sure that they remain happy and that we can continue to serve them? We also believe that good plans consist of surveillance plans, meaning we want to make sure that our workforce and our clients stay healthy, that if any potential risks do occur, meaning someone becomes sick or ill, that we're aware of that we're not allowing our business or our workforce or our clients to be exposed to someone who potentially could make others sick. We also are going to ask for high levels of compliance with these plans, meaning at this point, it's very critical for us to ask people to behave in a socially responsible manner and that we ensure good compliance to those behaviors. It's irresponsible for someone who feels sick or could potentially be sick to show up to an environment that makes other healthy people sick at work, at home, just in general in society. So we want to ensure good compliance to good behaviors, especially when it comes to infectious disease prevention. Now, your resources are going to be determined on the plans that you develop. If your plans are to keep a good, sound, safe workplace, you're going to have to screen people, meaning you're going to need thermometers. Before they go into the building, you're going to want to check their temperatures and make sure that they aren't feverish when they come into a building. Remember, approximately 20%, to be exact, it's like 24% of people who have a fever don't know they have a fever. And we want to remember that this virus is spread when people are symptomatic. So good screening of people coming into buildings is a start. We want to make sure that we take their temperature, and if they have a fever, they're not allowed into the building. We also want to be able to provide masks for people if we think that they may be around those that are sick or in an environment where someone who is sick could have been, or basically if they potentially are sick, we want them to have access to masks and plenty of hand sanitizer and be encouraged and empowered to wash their hands frequently with soap and water. The reality is again, your plans don't have to be complicated. They don't have to be strategic and numerous. There are simple ways that we can protect infectious disease or prevent infectious disease from entering our workforce. And there are simple strategies that we can take and implement to protect our clients and our workforce to keep them safer. The reality is that each organization is going to need its own customized plans and procedures. And Safer Behaviors can help you with that. But again, as a leader, it's very important that you are very proactive in your response to protect your workforce, your business, and your clients. Now, we talked about plans and resources. Now let's talk about objectivity and training. Absolutely critical that we make sure as leaders we're not using the media, we're not using opinions, we're not using feelings, we're not using fears to drive our decisions and our leadership in the organization. We're being objective. We're recognizing what the facts are, we're separating them from the fiction, and we're going to go forward and make good, sound decisions that are going to protect our employees, that are going to protect our clients, and that are going to, in the end, protect our business as well. We need to make sure that the employees, our workforce, understand the risk. We need to make sure that. We can't, as leaders, hold information back from them. So we have to make sure that we're providing information that allows for them to understand the risk, and that we're providing training that's actually going to keep them safe. We need to give them the skills. We not only need to give them the skills for maybe how to wash hands or how to sanitize their hands or how to practice social distancing, but we also need to give them the skills to speak up. If they see other people misbehaving in the workplace or not practicing socially responsible behavior, they should be able to address that and confront it when they see it. Those skills are desperately needed. We also need to give our workforce and the clients we serve a sense of safety, meaning they have to believe that they're safe when they're doing their job, that they have come to an environment where they can be safe, they feel safe, and they're encouraged to take their safety into their own hands, meaning we're empowering them to take safety into their own hands. This is something that has to be done. Again, we must remain objective. We must separate facts and fears and fiction. We must use facts to drive our decision-making processes, and we must, again, provide the workforce with the information that they need and the skills that they need to be safe. But also, we must continue to do that until they feel empowered and they feel like they are safe within the workplace that we're providing. So we've gone through PROT. Now it's time for the EC. Empathy and communication. Empathy is absolutely critical in this situation because we have to, as leaders, be flexible with different people's situations. I love the analogy of we are all in the same storm, but we all are in different boats. One boat may be shipwrecked, one boat may be leaking, another boat may be unsinkable. But the reality is that even though we're going through the same storm, everybody's individual situation is going to be different. As leaders, it's very important for us to be flexible to individual situations. There may be people who live with their parents or somebody who has a spouse that's fighting cancer. There's all sorts of things that we are going to have to consider, and it's detrimental, not only for trust, but for building loyalty and motivating in the workforce that leaders actually demonstrate empathy during these very tough times. If something does happen in the workplace, meaning we know that there's been an exposure, somebody has come down with COVID-19, or there's an employee that's sick with COVID-19, or maybe even fighting for their life, we shouldn't hide that. We should speak quickly, meaning address it quickly, frequently, as much as possible, and with a great deal of empathy, very much a high level of sensitivity. A lot of times we want to hide bad news. And the reality during very, very challenging times like this, it is best for you always, again, to speak quickly, frequently, and with empathy, especially when something unexpected happens. Last but not least, when something does happen, we should always give people something to do. Meaning, people will have this desire, as we talked about earlier with the Maslow's hierarchy of needs, they will have this desire to do something. So as a leader, give them things that they can do to be involved, to be engaged when something unexpected occurs. That's one of the best things that you can do. Again, in protecting your clients and your workforce and your business, always do your best as a leader to demonstrate the highest level of empathy and to communicate frequently, quickly, and with a great deal of empathy as well. Last but not least, in protect is T, and that's Thanksgiving. Thanksgiving is absolutely critical because during tough and uncertain times, we want to make sure that as leaders, we're not just recognizing what isn't working, but we're recognizing what is with a sense of thanksgiving. So we want to make sure that we reach out to the workforce and let them know how much we appreciate their efforts. We want to let them know that we're thankful for them returning to work in very uncertain times, that things may be a little bit more stressful than usual, and that we're appreciative of their efforts. We also want to recognize that the economy is tough, that a lot of people don't have a lot of money these days, and so when we have a client, we want to recognize and demonstrate thankfulness to them as well. A sense of thanksgiving openly and directly to our clients is a critical leadership aspect during tough times like these. And last but not least, we want to be thankful that we have an opportunity to serve, that the business is still open, that we're still able to provide a service to people. So demonstrating a sense of thanksgiving for the business and the opportunity is critical as well. That's where we're going to end the presentation today, ladies and gentlemen. I'm going to end it with thankfulness, a sense of thanksgiving for your participation and your attendance and watching this presentation. Here at Safer Behaviors, we believe, again, that you can do work safely. We can work safely around COVID-19. The question is really, what behaviors are you going to do? If you have any questions, please reach out to us. I'm going to give you our information on the next couple slides. And remember that Corporate Health Partners can and does provide services that will help cultivate a healthier workforce, not just with chronic conditions or even infectious disease, but they provide support services, an advocate, someone who is right beside the workforce, trying to keep them healthy or healthier during very stressful times like these. Again, thank you so much for your time and for your attention, and I look forward to serving you in the weeks, months, or years to come. Again, thank you for attending this presentation, and if you are looking for wellness coaches, please consider Corporate Health Partners. You can contact Jennifer at the phone number or email listed on this presentation, and she would be more than happy to answer any questions about the services they provide. Remember, sometimes it takes more than just a plan and information to keep a workforce healthier. Sometimes it takes a coach, a support, an advocate for someone. And knowing firsthand exactly how Corporate Health Partners works, I know they can make a difference for you and your workforce. If you have any questions for me, please email me or call me directly. I'd be very happy to answer any questions related to COVID-19, other infectious disease threats, or even any behavior you're looking to address in the workplace. Again, we are always safer when we do things together. So let's do safety together. And in the meantime, stay safe, stay strong, and I look forward to the opportunity to serve you.